So do you know that starvation is not the only cause of peptic ulcer disease? Yes, starvation is not the only cause of peptic ulcer disease. On this video, I'm going to be listing some of the things or lifestyles that can cause peptic ulcer disease. Before we start, I'd like you to share this video, like, comment, and don't forget to subscribe to my YouTube channel for more content updates. Thank you very much. So today we'll be talking about the various causes of peptic ulcer disease. I'd like to explain what peptic ulcer disease is. So peptic ulcer disease is an erosion or a sore in the stomach lining, which is known as the gastric mucosa, or the first part of the small intestine, which is known as the duodenal mucosa. So there's what's known as the protective factor or the defensive factors and the aggressive factors. So peptic ulcer disease occurs when there's imbalance between these aggressive factors and these protective factors. So these aggressive factors is what destroys the stomach lining, and these protective factors is what protects the stomach lining. The example of the protective factor is when there is proper blood flow to the stomach. Then we have the endogenous prostaglandin. We also have the mucosa bicarbonate. So when these aggressive factors overpower these protective factors, and ulcer is being formed. So why people are thinking that starvation is the only cause of peptic ulcer disease, there are other causes of peptic ulcer disease, which are the aggressive factors. Yeah, so let's talk about the examples of these aggressive factors that can cause peptic ulcer disease. So the number one cause of peptic ulcer apart from starvation is H. pylori, which is Helicobacter pylorix. It's a bacterial infection, and it's the number one cause of peptic ulcer disease. So this H. pylori is linked to 80 to 95% of duodenal ulcer and 60 to 90% of gastric ulcer. Yeah, so apart from peptic ulcer disease, this H. pylori can also cause chronic gastritis and gastric cancer. Of course, it's bad. And this H. pylori is spread through contaminated food and water. And then the second cause of this peptic ulcer disease is the use of NSAID. Excessive use of NSAID, that's the word, that is non-steroid anti-inflammatory drugs. For example, there's ibuprofen, diclofenac, and aspirin. These drugs, when taken excessively, can damage the stomach lining. So for those people who keep abusing this drug, especially those people that go to the chemist and start complaining, I have body pain, and those chemist people, because they are looking for money, they will now combine drugs and give to them, and then they'll go home and take it innocently without even asking the name of these medications, and start taking it, start abusing it. You know, people like farmers, bricklayers, not those people that does those strenuous job, they tend to abuse this NSAID, and it is bad. It causes peptic ulcer disease. And then the third one is smoking, and smoking reduces blood flow to the stomach. Smoking, I'm not saying you shouldn't smoke, or I just want you to be aware that smoking is bad for the health. Smoking can cause peptic ulcer and also cause other health conditions. And then the number 4 cause is alcohol consumption. Excessive alcohol consumption, that is the word. Excessive alcohol consumption can irritate the stomach, thereby making it more vulnerable for ulcer to occur. So another cause of peptic ulcer disease is chronic stress. Yes, although stress does not directly cause peptic ulcer disease, but stress can reduce your immune system, thereby causing delay in recovery. So when there's now combined factors like H. pylori and misuse of NSAID, which is non-steroidal anti-inflammatory drugs, when this occurs, stress cannot significantly contribute to peptic ulcer development. And then there's family history. There's a particular blood group that have the higher risk of developing peptic ulcer disease, and this blood group is blood group O positive. Yeah, they have a higher tendency of having peptic ulcer disease. So that's why I said family history can also cause peptic ulcer disease. So peptic ulcer can be prevented with the right habits and lifestyle. So if you notice any abdominal pain, instead of going to the chemist to ask them for medications before they will give you drugs that will worsen these symptoms, because trust me, peptic ulcer can perforate, and when it does, it becomes really bad. So if you notice any symptom, if you notice any abdominal pain, please go to the hospital for an expert management. Don't joke with peptic ulcer. As much as peptic ulcer is very common, it is dangerous also. People tend to joke with it. When they have stomach pain, they'll just take a mismang, and please go to the hospital for expert management. So thank you so much for watching. Don't forget to like, share, comment, and subscribe to my YouTube channel. Thank you very much. See you on my next video. Bye.